You can't stay up here.
Hi, good morning. Welcome to the Skin Games and Dr. Mitchell Schwartz's class, the science of microchanneling, optimal product penetration, and the magic in the serum. Dr. Mitchell Schwartz is one of the only dermatologists that is the head of any device company or serum company. He was a board-certified dermatologist, now retired, for over 35 years, and he is the creator and our chief medical officer of Procell Therapies.
The switch, just switch it on.
I just turned it on, so I think we're good. Okay, well, thank you to everybody for coming here this morning. It's great to see everybody getting up early to attend this, so thanks for coming to see this. Thank you, Carol, for the introduction. And we'll talk today about microchanneling and our serums and what's new and why we're excited about the results for microchanneling and microneedling, and why they're important and why our serums are important. And something else that I think is really important for everyone to understand is how to really differentiate, how to distinguish between reality and hype. And there's just so much hype in the marketplace right now that I would love for everyone to really take a step back and say, is this real? Is this science-based? Can I make a decision on whether to use this product? Because there's so much out there right now. There's so much hype. And how do you separate it? How do you know who's really telling you the truth? Who's really giving information that's science-based rather than motivated by money? So I think there's a lot to learn in that respect, and we're all a bit overwhelmed with all the new things coming out and how to really make a good decision about what makes sense. So first, disclosures, which I think are super important. I had a break from Hyman in Philadelphia, internal medicine, internship and residency, dermatology residency, certified in dermatology, by the American Board, over 40 years of private practice, which seems forever, and the founder and chief medical officer of Procell Therapies. So I underline two things that I think are super important. One is I'm from Philadelphia, and two is the chief medical officer of Procell Therapies. So why are those two important? Well, I grew up in Philadelphia, and year after year we got trounced by the Dallas Cowboys, and it was just terrible. We were in last place there. So the last two seasons, the Philadelphia Eagles won the division and then won the Super Bowl last year, which is pretty phenomenal. So every dog has its day. I lived long enough to experience that, and super exciting. And this is my first time in Dallas, so I think it's fun to be here. The second important part is that I'm the chief medical officer for Procell Therapies, so obviously you have to listen to things I say and know that I have a financial interest in the company, and you want to make sure that everything I tell you is really truly science-based and not biased in any way by financial incentives. And unfortunately, that's the driver behind most things these days on the market, and there's so much hype and it's just hard to really tell. So how do you sort through all that? Well, you want to know that the source that you're getting this information from is trustworthy or trusted. A lot of trusted sources out there. You can see a doctor in a white coat with gray hair, top of sort of looking and say, well, I can trust this guy. You can see a PhD who teaches at a medical school and starts a company and say, yeah, that seems like someone you can trust. And that's true, but are they trustworthy? What they're telling you is truly science-based, or is it being influenced by what they're making through their companies? So you have to look closely at the data, and you can have a ton of data thrown at you, and how do you sort all out and make sense? You really have to spend time looking at it, looking critically at it. What are the methods used to collect that data, and is there a connection that makes sense? Is there logic behind it, or is it just a little bit too far out there? They say, well, this did this, therefore it does that, and the connection seems a little bit weird. That's a little more tangential than for real. And I'll try to point it out to you. So, what's trustworthy? Are the facts from evidence-based research? Are the references in major, widely accepted scientific journals? or just in a journal that you've never heard of? Are the trials done on humans? Are they testimonials and anecdotal evidence, which are nice, and we all have those, but they really don't mean anything. And that's the primary thing being thrown at you, and you really have to wonder, well, you need more information than just anecdotal evidence. So let me start off with the skin health and beauty pyramid. So I've been doing this for a long time, and I was at the front edge of when cosmetic dermatology became a real thing. And this was maybe 15 years ago or so. This article came out called the Skin Health and Beauty Pyramid. This was 2014, so it was 12 years ago. And I thought this was a great article. I took this pyramid and I made a big poster and I put it in all my rooms. And all my patients coming in for cosmetic treatments, initial visit, consultation, I went through this pyramid to get them on board with how to properly take care of their skin, in addition to all the things that we were going to be offering. I talked about even diet and nutrition and kind of spent time just getting them oriented properly. But I think this sort of summarizes all the things that we want to do for our patients. So if I look at the bottom level of the pyramid, and I had this on posters at each of my examiners, so I went over them on the handouts for everybody with diets. The protection and repair is a fundamental level, and that's using sunscreen, which is an everyday thing you should do to protect your skin, and it's using antioxidant, because we have really good antioxidants in the market, and in particular, I was using SkinCeuticals CNE Fluid as the one that I recommended for everyone, and that's what I use every morning as a really nice antioxidant. The second layer is transformation, and transformation is important because at the time that was kind of all we really had that we worked, and I had people on retinoids, good old-fashioned retin-A. And I had patients on retinoids for 20 years plus, and they refused to stop because they just loved the results. And they had a nice glow. And that was kind of the routine that we did. In that category are also the alpha hydroxy acids, and that's where the chemical peels really fit into the treatment. And the estheticians were doing lots of chemical peels, and you guys know how good the results are. So for chemical peels, I actually just want to mention the mixing peel, because I think you should stop at the booth. Maddie will tell you why her peels work so well. And that's where they fit in that transformation phase. You stimulate exfoliation, increase cell turnover, and you make your skin look good. At the top of the pyramid, which is something that was brand new, was the cytokines and growth factors, and that was just coming into the market. And specifically, Neocutis had a product that was made from growth factors from fibroblasts, and we sold that in my office, and my patients were coming back saying that they really noticed great results, much better than anything that they were using before. And I didn't really have that experience prior to that. We had things that were good, but not great. Under eye wrinkles were responding, which were really tough. And when other people told me about that, I started thinking, hey, this really is something. Something's going on here. And then the pyramid came out, and I realized that this was a revolution in topical care using stem cells to create cytokines and growth factors that really need looking into. Last thing I mentioned on the slide is the DNA repair enzyme, which is the bottom level fundamental, and I have an arrow pointing to that. And that's something new, and we have it in our serums as well, so I'll mention that in a little bit. So why does microneedling work? Well, quite simply, microneedling creates an injury to the skin. And your skin recognizes an injury, it sets the immune process in motion, the cells start to repair themselves, and skin cells in the area, stem cells are there, and they start creating cytokines and growth factors to help heal things. So that's the response that you want to induce. So whatever it is you're treating, for example, like acne scars, then it just creates more collagen and it helps to lengthen the scars and smooth the skin out. So that's the mechanism behind microneedling. They call it collagen induction therapy because it stimulates electrical currents, but in reality, rather than the mystical electrical currents, I really like to think of these growth factors as the ones that are the main drivers of this whole reaction. So with that in mind, I'm going to show you a case study. Case studies are great because they're designed ahead of time. The people doing the study sit down and say, what are the parameters? Let's do controls. We know exactly how to run this, and we get great results from that. As compared to a review study where you look backwards and you put a bunch of studies together where you have lots of patients, but the problem is there's a lot of parameters that you have to factor in, and you don't always get the results that you want because there's so many variables that could play a role that you can't filter out. So a case study using automated microneedling monotherapy, nothing else was done other than microneedling for androgenetic alopecia, and they compared 3 different depths. Depths were 0.5, 1.0, and 1.5 millimeter needle tips. Each patient had 6 sessions over 3 months, 2 weeks apart. And in all groups, they had improvement. They all had hair regrowth. So just microneedling alone stimulated hair growth. So the question I want to ask everybody is, we all know how deep the hair follicles are in the skin. They're many, many millimeters down, maybe a good 4 millimeters down below the surface of the scalp. And you're using needle tips of 0.5 to 1.5 millimeters. How does it work? The needle tips don't reach down to the hair follicle where the growth center is, and you find a wake up a hair that's fallen out and go back again. How does that work if it doesn't actually get deep enough to physically stimulate things? So something's going on besides the trauma of making holes in the skin. And the patients and the dermatologist doing the study and microscopic findings showed that the 0.5 millimeter depth was the most effective of the 3 different length needles that were used. So that's the Schwartz needle, which seems a little counterintuitive. If it's that work in the hair follicle, why would that work? Interesting. The other thing I highlighted is that they did 6 sessions over 3 months, 2 weeks apart. And I thought that was a great protocol. So when people say to me, what do you recommend as a good way to start your patients on the treatment? That's what I think is the best course. I suggest giving them packages of 6 treatments, do it every 2 weeks, so it's twice a month, and they have a total of 6 treatments over 3 months. And that gets them on board. It gives them a chance to really get a good result. They're not doing it step by step, waiting to see things and expecting it too soon. And then you'll be pleasantly surprised when they get better much sooner than 3 months, but it's nice to have them on board for the whole treatment session. So the skin on the scalp is typically 4 to 5 millimeters thick, so that gets back to that question as well, how does this work if it doesn't, the needles don't go that deep in the skin? The hair growth cycle, about 10 to 15% are in the resting phase. There's stem cells way down in the dermal papillae, and they send signals to the hair matrix to start growing again. So how does that work? There's this so-called WNT beta-catenin pathway, which is a cytokine that's created by one of the stem cells that tells the dermal papillae, or the signals from the dermal papillae, tells the hair matrix to wake up and start growing again. So there's messengers happening in there, and that's what the microneedling does. It creates a stimulus to the cells on the surface of the skin to send messengers down, tell the hair follicle it's time to wake up and start growing again. So that's how these needles work without penetrating way down the level of the hair follicle. Study done in 2011 by 3M, and they had a little plastic tool that I actually use in my office. It looks like a tiny tennis racket, and on the racket head there's these tiny little pyramids, and they're so tiny you can hardly feel them. So they don't go that deep into the skin. You can penetrate at 0.1 to 0.15 millimeters, and you just pressed all over the face with this little thing. Didn't seem like a big deal. And then they did this study where they put lidocaine on the surface of the skin after the treatment, and they did skin biopsies, and they showed that there was a 340% increase in the lidocaine lower down into the skin. So it caused, and this was comparing the microneedling versus not, they found that there was a dramatic increase in how much lidocaine penetrated. So something about those tiny little tips disrupted the barrier function of the skin to allow things to penetrate. Again, that's super small, 0.1 millimeters. Like, if you looked at these things, you wonder how could that possibly do anything. Well, how thick is the stratum corneum in the skin? And here's a study back in 2014, 18 healthy subjects, and they simply showed the stratum corneum very nicely with spectrophotometry. They showed that it averaged about 0.13 millimeters on cheek. 0.13, that's about the size of these tiny little pyramid tips from 3M. So that's interesting. That's the stratum corneum, and that's the barrier layer of the skin. Once you get past 0.13 millimeters, anything penetrating through that then can percolate down. And the gates open, the horse is out of the barn, and it's in there. Facial skin is typically about 1 millimeter thick. So that's the thought now, is if you can get past the stratum corneum, then that's the whole key to getting things to penetrate deeper into the skin. And here's another study back in 2005, just showing average facial skin thickness is just over a millimeter thick. Eyelid skin average 0.8 or so millimeters thick. What that means is that if someone's using a micro needling device that's a millimeter or greater, you're going actually through the full thickness of the skin, which puts you into the subcutaneous fat. So there's lots of nerves, lots of big blood vessels, a lot of pain, a lot of bleeding. And why would you want to do that? Because it'll make your patient miserable, and there's nothing in the subcutaneous fat that you need to reach if we're thinking that we just got to get past the stratum corneum. So there's a lot of offices where doctors are using longer needles, and as much as I try to tell them otherwise, they have to feel like longer is better, deeper is better, and we're going to really rough it up and send them home nobody, and they'll really feel like they got a treatment. But I do try to talk them out of that all the time. So what's the best length? Well, a study done in Germany, 2008, they used dermal rollers, needle length 0.15, 0.5, and 1.5. Huge variation. They measured penetration of hydrophilic drugs in the human skin. Did biopsies afterwards. They do fluorescence so you can see the drugs under the surface. 0.5 millimeter needle length was best for drug delivery purposes. Well, that's interesting. That's what it was for the hair oil. Second place was 0.15, and last was 1.5. So ideally, I recommend 0.5 for penetration of anything topical. If you're an esthetician in a state where you might be maxed out at 0.25, that's all you're allowed to use. It's nice to know that here's 2 studies showing you how well it works with short needles. 0.15 millimeter needles is nothing, and we offer that as well now in Procell. We have that lens for people that want to go small and get great results. And the office down the street, you may have a physician who could use 1.5 and thinks, hey, I can use it, I want to do it. You guys are better off with the shorter needles. You get better results. You'll have more happier patients. And we have the science to show that that really is the case. So it's nice to know you're in a better position. So that's a great study back in 2008. It's a long time ago. Case study that was set up using microneedling in androgenetic alopecia again. They compared 2 different depths of microneedles, but this time they combined it with minoxidil, which is real gain. They used 0.6 millimeter tips and 1.2 millimeter tips. Both groups of people had results. However, the 0.6, surprise, surprise, was better than the 1.2 millimeter. Yet again, and these are case studies, so it's set up, designed to get rid of all the other parameters and just look at the difference between the 2 needle tips. No other variables, which is a great way to prove it. That's kind of what microchanneling is about. Combining a topical medication with the right kind of needles to enhance penetration. So then the question is, ask everybody, why? Why would a shorter needle work better than a longer needle? Wouldn't you rather have a deeper channel that's just going to get your medication deeper into the skin than just through a tiny little opening that only gets you past the stratum corneum? Isn't it better to just get it a bigger boost to get it down there? So think about that. There must be a good explanation somewhere. What is it?
The dermal junction, which is everything starts at the dermal junction, which gets starts all collagen.
Yeah, but the dermal junction is a ways down. So microchanneling versus microneedling. What is this term microchanneling that we invented in Procell years back? Microchanneling uses science to create optimal product penetration. So that's sort of the meaning behind the definition, using science for optimal product penetration. So what does that mean? Microneedling is simply stimulating production by wounding the skin. Microchanneling is creating precise microchannels in the surface of the skin with minimal tissue trauma. So your skin hardly notices that something's happened to it, but we've created this tiny opening that stays open for a while, hours, even 24 hours, and whatever solution you put on top of the skin will penetrate readily past the stratum corneum and then permeate down to where you want it to work. If you use longer needles, it stimulates a wound reaction, inflammation. It causes tissue edema, fluid flows, and the channel is closed very quickly. So the top of the solutions you put on don't penetrate as well. Or the cytokines and growth factors that say the stem cells in the skin are producing in response, they won't penetrate as quickly or as well because of the edema within the channel. So in my mind, that's the key to microchanneling. It really makes a difference. The whole goal here is to get things to penetrate better. So how does it work? Why is our system better at making the right type of holes in the skin? Derma rollers work by entering the skin at an angle and exiting at an angle, and it creates a slash mark in the skin. And you can picture that in your mind as how the dynamics work. And needles entering at an angle and going out at an angle will leave a little slash. So that's kind of traumatic and causes more tissue edema. Other companies, pen-based systems, have tiny tips. So it takes forever to do a treatment, so they recommend the gliding or the dragging technique. If you drag it across the skin, it'll do the same thing. The needles kind of enter at an angle and out, it creates more slashing. And studies have been done looking at the depth of penetration, and the depth is all over the place. It's not even penetration. You'll see shorter depths, longer depths. It just depends how fast you move the device and how well or not well you stretch the skin. Looking at the Procell system, we have fixed tip needle lengths. We have larger tips, which means short treatment time. These large areas at once, and we teach people to do a tapping technique. So the tapping technique gives you the exact penetration of the length of the needle, so we know it's very consistent, and it's not entering at an angle, it's going up and down gently, and that creates minimal tissue trauma, which is really the key that we're talking about now with product penetration. So that's the difference in work. So how can I prove that to you? I'll show you a clay model. And we did this at our booth when I first started the company. We would have apples, we would rub a dye over the surface and have people coming up use all three different techniques and then wipe the dye off, and you could reproduce this every single time. It was pretty remarkable. The Procell device created nice little narrow channels. The pens had that other pattern on the apple. In this case, it's a clay model, and the roller, same thing, wider and full. So you can kind of see that for yourself and test everything even at home. So again, don't believe me, try it yourself and see what you think. But this is incredibly useful. So that makes sense to me. That's all part of that concept of minimizing the trauma to the skin to get better penetration. Review article done 2024. It's a review article. Lots of subjects, but things are all over the place. 696 subjects, 13 clinical trials, twice a week treatment every 4 weeks. They combine lots of stuff with microchanneling. They use minoxidil, PRP, fibroblasts, growth factors, spironolactone, finasteride, and dutasteride orally. And they found that everything worked better with combination therapy. So I'm a big fan of combining therapies. And there was no consistency with needle lengths and everything else, so not much else to be gotten out of this, other than to say that if you can combine the treatment with other modalities, whether it's topical or oral, then it's beneficial. And a couple years ago, one of our reps came up to me and said, when we first came out with our hair serum, I'm getting great results. So I said, well, send me some pictures. So again, getting a little anecdotal here, but she sent me these pictures from 2024. I was impressed, and I was excited actually to see how well our hair serums were working because they were fairly new. And these are just two patients that she sent me. Just wanted to put up just to show that it's nice. And this is only after a couple months of treatment. So it really was impressive that it was working. So what is it about the serums? Why do our serums work so well, and why do I think they're the best thing going out there? Because you guys have so much to pick from, so many things in the market. And that's what I think is super important right now. We're all getting bombarded with promotional hype. And how do you figure out what's real, true science, and what's just somebody promoting it and some celebrity saying how amazing it is and how much better they look, and they had one treatment and it's the best thing they ever did. Yeah, we're all excited about that. We all want the holy grail. We all want something that's going to make our patients say, wow. So we want to believe. We want to believe people when they say, this is amazing, you should do it, because we all want that. So how do you figure out what's really there? Well, cytokines and growth factors became a big buzzword. And what are they? They're just methods of communication. It's the way cells talk to each other. And all cells communicate except for red blood cells because they don't have a nucleus. But all the other cells talk to each other. And we're learning more and more about that every day. So it's a great expanding science that keeps changing. So you really keep on top of that just to see what new stuff coming, because it's great stuff. And as we invent new things, we can do a better job of what we're doing to make better things that work better. So I like the thought of always being open to changes, and when something comes out that works better than what we had before, I'm all over that. And that's the big deal that I think we all need to watch for and know what's going to be real and what's not going to be real. So with that in mind, what are these things, cytokines and growth factors? They're signaling proteins. They tell other cells what to do, to grow, to proliferate, differentiate, survive. There's so many now that are in different categories based on what they look like, where they attach with other cells, trying to make sense of putting together into families so that we can talk about it more intelligently. They operate at close distances, which is called paracrine communication. And it takes very, very low concentrations for them to do what they do. What are the different methods of communication? 3 kinds of hormonal signals. Endocrine, we all know, that's where a cell secretes a messenger, gets into the bloodstream, and it goes somewhere else in the body where it has its effect. Autocrine is where the cell secretes a message and it turns around and goes back in the cell and tells it what to do, which seems kind of weird to me, but it's well documented. Liver cells do that with an injury. It helps to stimulate itself to grow. Cancer cells do that. It helps stimulate the cell itself to start reproducing more quickly. So it's a known thing, but it's kind of an odd thing. Paracrine communication is what we're looking at, and that's cells talking to each other right nearby. And those are the cytokines and growth factors used in wound repair that are the important ones for what we're doing. And here's an example of various families. There's a lot of them there. And it's just a way of grouping everything. And so a lot of it in terms of function, what it does, how it works with inflammation, how it stimulates blood supply, how it stimulates collagen. They do all kinds of stuff. They do some things that are great and some things that are not so great in terms of self-destruction, killing off cells so new ones can form. They do all kinds of things. So there's many, many different kinds out there, but we know which are the better ones with wound healing. We know which ones are the anti-inflammatory ones that quiet down the inflammation in the healing area and actually give us better results from things like microneedling and microchanneling, which is really what we want. So looking at the different types of cytokines and growth factors, the best way to do this is let's group them. Autologous means it's from the same individual, and a good example is PRP, where when you do a treatment, they take your blood, they spin it down, they take the platelet-rich plasma and smear it on your face and do a treatment. The allogenic variety means it's from the same species, and that's important because there's a lot of plant cytokines and growth factors which sound nice. So it's cheaper. Some countries don't allow human products, so you have to use plants there. But don't believe it when someone says it's just as good. So allogenic comes typically from single-cell conditioned media, which was neocutis when they used fibroblasts. Comes from stem cells, which was a big deal for many years now. Comes from exosomes, which is another new buzzword now that you'll hear all the time, and I'll address that in a few minutes. And then the last category, which is brand new, is bioengineered, and that's what we use. I've been watching all these for many years, and as a small company, we can pivot quickly. Whenever I see something better is out there, we can adopt that right away, which is the advantage of running a small company and being the only one in charge that everybody listens to. So it's pretty cool. I don't need to get anything approved when I decide. So I've been looking for years. When exosomes first came out forever ago, I looked at that
and questioned a bunch of things about it and said, no, I'm not ready for that. There's some real risks here. So that's not good. And I'll explain why. When they came out with bioengineered a long time ago, they just weren't that good. And I said, this has potential, but we're not ready for that yet. So I went into the stem cells conditioned media, as I'll show, because that was really what I felt was the state of the art at the time, and it was. Looking at the cytokines, let's group them in the anti-inflammatory versus the inflammatory category, red versus yellow. And the chart just shows lots of different cytokines that, with abbreviations that are being categorized there just to help think about this, because we know that anti-inflammatory effects are really important in wound healing, and the inflammation is not always a good thing when we're dealing with this type of thing, with microneedling and microchanneling. Looking at sources, let's start with platelet-rich plasma to make some sense of all this now. Platelet-rich plasma is very inflammatory. And there's your seesaw showing how much of the inflammatory cytokines. This is the profile you'll see with platelet-rich plasma. So you have lots of different cytokines and growth factors in there. So it's a whole mix of all this stuff, but it's predominantly inflammatory. And that makes sense. You get an injury, the platelets go to the area, it helps to stop the bleeding. The inflammation increases blood flow, it brings in all the other cells to heal things. So inflammation is kind of necessary for the healing process. So it makes sense, but you can't control it. It's whatever's in the platelets is what you're smearing on the skin, which generates a lot of inflammation. And as we all know, inflammation is pro-aging, so for all the things we're hearing these days, you kind of want to stay away from anything that's inflammatory. I did not treat Kim Kardashian, I'm happy to say. And this is on the web. She has her picture there, and she was quoted as saying it was the most painful thing ever. It's one treatment I'll never do again. So I thought that was kind of funny to see that, because the vampire facial really made PRP a big deal back in the day, and there's still, a lot of people are still doing that. And as I'll show you, for no good reason. The next category is fibroblasts, and that's where Neocutis came in. The problem with fibroblasts is that they take orders, they don't give them. So this is an article just showing that mesenchymal stem cells are the ones that are telling the fibroblasts what to do, how to respond to an injury. So they're not the primary drivers of the system, they're just the foot soldiers. So not the best source, but it worked. That was Neocutis, and it was giving great results. And that's what started me down that pathway of, wow, we're really onto things here. We know what we're doing now. But there's better choices than fibroblasts producing these growth factors. That gets us to stem cells, which typically are harvested from adipose tissue and bone marrow. So let's talk about those two categories. Stem cells are the generals. They control tissue healing. They start in the bone marrow, patrol the body through the bloodstream, and then once they get to an area of injury, they release cytokines and growth factors that reduce the inflammation, suppress the immune response, and orchestrate the healing process. So they're really, they're key, they're in charge. Stem cells are factories that make cytokines and growth factors. You grow them in the lab, they make a broth. Broth is filtered, it's irradiated, there's no living cells present, which we ask it is all the time. Is there living tissue in there? No, it's all killed. I don't want stem cells going into people that can do all kinds of things that we don't know what they're going to do, and I don't know how safe that is. They are using stem cells for injections for many, many medical problems now, so if they're super careful and know exactly what stem cells they're putting into people, it seems to be safe, but you have to be careful with stem cells and that you know exactly what's going into people's bodies because they come from other people. Adipose-derived stem cells, very inflammatory, consistent with the inflammatory effect on the body seen from fat, especially visceral fat. We know inflammation is not a good thing. Why would anyone use adipose tissue stem cells? You won't get a straight answer if you ask. You'll get a scientific explanation that sounds like, wow, they know what they're talking about. My opinion is because it's cheap, because they do liposuction and throw out fat. So they get all the fat they want, they get all the stem cells they want. It costs them practically nothing to get things from stem cells, like from adipose tissue, like stem cells and like exosomes. So I think they do it because it's inexpensive, And it works, like we saw with PRP, but it's not optimal because of the inflammation. In the little metaphor in the symphony of tissue regeneration, the bone marrow stem cells function as the conductors. So the best stem cells are these mesenchymal stem cells that come from bone marrow. Why? If you look at the cytokine profile, they're very anti-inflammatory. So that's the pattern they produce, and they put out the fire. And I think that's super important in terms of wound healing and getting the type of results that you want to get and the results that we're seeing. How do I know that? Well, what's anti-inflammatory that I can show you? Well, this is a patient with acne that was treated with Procell system, just the microchanneling treatments, and dramatic improvement just from this alone without acne treatment otherwise. So why is that? It's anti-inflammatory. Acne is an inflammatory process, and that quieted down the inflammation and made the acne go away. I mean, to me, there's no other good explanation for this other than because of the tremendous anti-inflammatory effect. We can treat patients with rosacea, which is inflammatory skin disease, with just our serums, and the rosacea clears up dramatically because it's an inflammatory skin condition. We can treat patients with hyperpigmentation. Melasma is not just pigment in the skin. There's a band of inflammation just beneath that. If you biopsy the skin, you'll see that. So this is not a chemical that's bleaching the skin. This is its anti-inflammatory effect. And the only treatment that she had was microchanneling using tiny needles and significant improvement, I believe, again, because of the anti-inflammatory effect. When I started my company 10 years ago, I met with Dr. Lance Sitterfield, who wrote this book, The Concise Guide to Dermal Needling. I highly recommend it. It's a nice paperback book, lots of great pictures. Lance, I think, is a really smart guy, and he wrote a great book. And it's one of the few books that just is complete, and you can get through it quickly because of all the pictures. But it's very well written. So I recommend that as being the best book to learn all about microneedling. Lance and I met with a company that just had started, and they were making serums from the mesenchymal bone marrow stem cells. And we sat down with them in a meeting at a table, and we outlined a formula for a serum that was just right for microchanneling, not a lot of added stuff, just preservatives to make it safe, but having all the right cytokines and growth factors that we felt were optimal. And they made it for us specifically, and that became the basis of our system. So when I first started using this and created this whole system, this was my first patient with acne scarring that I treated. And back in the day, I did everything for acne scars. You name it. I've been doing this forever. So this patient would come in to see me. I would do laser resurfacing. I would do dermabrasion for the aggressive, not the lightweight stuff. I would do subcision with a wide spade-tip needle and 3 of attachments underneath. I would do chemical peels with toothpicks at the base of these scars. I did punch grafting for the deeper ice pick scars, taking skin from behind the ear and grafting it in place, and then sanding the whole thing and getting rid of the deep scars. And I probably would have done a combination of all that for him. All I did was, and I did this personally, this is my first patient I treated, all I did was microchanneling treatments. 4 months later, I took after pictures, and I couldn't believe what the results showed. I was blown away. It's like, really? I would have put you through misery with all the things I normally do, and now you don't need anything. You're just great. I might use a little collagen for some of these because scars, a little injection under there, but everything else responded amazingly well. So I looked at that and said, holy mackerel, this stuff really works. And it's a tiny needle. It's way better than I ever anticipated. This was my other first patient I treated, 74-year-old woman, and I treated her for wrinkles, 4 monthly treatments, and same thing. I looked at the after and said, this is a little hard to believe. This is pretty remarkable. This is anecdotal stuff, but it's how I started the company, and I kind of said, wow, I think we got something going here. Let's move this thing along. So that was super encouraging. Let's talk about exosomes. And I've been approached by exosome companies forever, since before any of us ever heard about exosomes. And I've been learning a lot about them over the years, waiting for them to be something that I felt were something I'd want to use for the company, because if it's better than what we got, I'm all over that. I want to get bigger and better, just like everybody else. So what's the story with exosomes? So be careful, because you're going to hear a lot this weekend about exosomes. And I really want everybody to understand what this is about, so you can ask the right questions when you hear people telling you things about exosomes. They're extracellular vesicles that are secreted by living cells and then picked up by other cells nearby, but not always nearby. It gets in the bloodstream and it goes throughout the body. Highly dependent on cell origin. Depends where they come from. How do we know where they come from? The companies will tell us, and we have to believe them. They transport various cargoes to the target cell, including DNA, messenger RNA, microRNA, cytokines, cytoplasmic proteins. Do they work? Yes, they do work. They have cytokines. We know cytokines can be great with the right ones in there, so they have to pick the right ones. What about the DNA? What about messenger RNA? Again, I don't like DNA from somebody else in my body. I don't know what it's going to do. What does messenger RNA do? It sends messages to cells and it tells them to do things. Sometimes it tells them to do things that they've never done before. Well, that scares me. So from the beginning, I said, I don't know I want to do that. I'd rather give them, I know it works with the cytokines, why don't I just give them the cytokines? We don't need to have everything else in there, and we'll get the same great results, unless you can show me how this works better than just cytokines by themselves. So can you show me that? Well, if you look at the National Institute of Health Cancer Institute website, and I encourage everybody to do this, you just Google it. Whenever I say something to my son that sounds a little bit suspicious, he pulls out his phone and in 30 seconds he shows me that I stretched the truth. No, that's not really the way it is. Well, do that. Check on your phone, go to the NIH, and just Google exosomes. And you'll see this here. I copied this right off their site. The release into the blood by many types of cells, including cancer cells, travel all over across the blood-brain barrier. They transfer DNA and RNA that they contain into other cells. They may play a role in the spread of cancer, and they also keep immune cells from killing cancer cells. Well, that's a little scary. Do I really want to chance that? Well, I got to know where the exosomes are coming from. If you Google the words "the darker side of exosomes," which I just did a couple days ago, this article comes up, which was back in 2021, but a whole bunch of other articles came up, and they all have quoted these terms, the darker side. They can change the phenotype of target cells. A cell that does one thing in the body suddenly does something completely different that it was never programmed to do. Well, that can be great, but it can be bad. You got to know what it is you're telling the cell to do. How safe is that? It's shown that in participating in the development of diabetes, spreading of neuronal damage, and Alzheimer's disease, secreted by cancer cells can transfer oncogenes and spread the cancer. From hypertrophic adipocytes, it contributes to obesity-related complications. So these are all the bad things that have been proven to be associated with exosomes. Therefore, it comes back to the same thing: know your source, make sure that it's safe. How do we know? How do we know the company that's promoting exosomes gets something that's safe source? And there's no way to really, know for sure that they're telling you the truth about what they're doing. And I can give you examples of that, or I will. The good, the bad, and the ugly. This is an article that came out in 2023, not too long ago, by a physician at Duke University. And I threw Clint Eastwood in here. It's a great picture. But this article very specifically says therapeutic effect is wholly dependent on the donor cell, which we now know. Exosome-driven changes can be either disease-altering or promoting. They can harm as well as heal, and they're not approved by the FDA. You can't use exosome products in a lot of places, especially human-derived. Europe won't allow that. I was just told Canada is not allowing them. The U.S. seems to allow a lot of stuff for whatever reason, so we can use them here. But a lot of places are not allowing them for good reason. And it's been said that it's limited. It should be limited to clinical studies. They are not FDA approved. No matter what anybody tells you, we're not FDA approved. And you can Google that. So that's significant. You could say, well, no big deal. The FDA, they're always whatever. But sometimes there's a reason for that as well. As opposed to stem cells and all the things that we are doing and have huge studies and are FDA approved for all kinds of things like what we're using them for. So why did I not get into exosomes? Well, it's been shown for sure that long-term storage, to keep them viable, you have to keep it at minus 80 degrees centigrade. Medium storage for weeks, minus 20 to minus 30, short-term in the refrigerator, up to a week at 4 degrees. So if you get this stuff in and use it, you better have some great storage or use it in a big hurry. Well, how cold is that? I mean, that's seriously cold. So that picture of Whitefish Mountain Resort, I was skiing at the top of Whitefish in Montana. And my wife will appreciate this. We came over the top of the mountain, we looked at this sign up there, which is a trail map, and it was minus 40 degrees Fahrenheit. And we said, oh my God, it was cold. I don't think exactly. But it was cold. So that's what you got to keep these exosomes at, minus 40. Well, that's Fahrenheit, and this is centigrade. Anybody know what minus 40 degrees Fahrenheit is in centigrade? This is a trick question. That's the one place where Fahrenheit and centigrade cross. So minus 40 is both centigrade and Fahrenheit. And let me tell you, that's cold. So if you're going to use this stuff, that's what you got to keep it at in your office. So how do they get around that? How can they sell you things that have exosomes when this is a requirement? Which was why years ago I said, well, we can't do this. You know what's going to cost to transport and put it in an office. So what did they do? They did a process called lyophilization. They lyophilize exosomes. They freeze-dry them. So this is from a website that sells these products, Exosome Regenerative Complex. It's freeze-dried and kept at room temperature. You reconstitute it, you use it, and you're good to go. That sounds ideal. Is it? Is it ideal? How do we know that it works? You talk to the exosome companies, as I have, and they say, yeah, you reconstitute it, and they're there. There's exosomes, and they're great, and they work great. Oh, okay. Well, let me see the studies. Well, they'll whip out a white paper, and we did it in our lab, and the scientists said it works, and they're there, and we know that that's the case. And I'll say, well, show me a third-party blinded control where they didn't know which was which, and one that was cold, one that wasn't, and they show it worked. And everybody will say to this day, well, no, we haven't done that. We just do it in our own lab, and we know that there's plenty of good exercises. And I say, thank you. Come back when you show me a good study. A week ago, I talked to someone that I respect, is very knowledgeable, and I said, I'm going to be talking about this again. I keep looking, and I haven't seen anything yet. And he's on the board of 2 exosome companies. I said, do you have anything that shows that this lyophilization works, that we know for sure? And he said, well, our lab does it, and we know that it's good. But there's nothing on the market, nothing out there, studies that show it actually works done independently with blinded controls. And I said, why not? Everyone else is doing great controls, and that would be convincing. And he said, oh, it's too expensive to do that. And that didn't pass the sniff test. That's dumb. With all the money they make to not do that type of stuff, it makes no sense to me. So I will show you a study that was done. And this was done at Harvard Medical School. These are people that are well-respected, 20 years of experience working research with exosomes, use the transmission electron microscope. They used samples that were kept at minus 80 degrees centigrade, saline preserved, and they used some lyophilized samples. But it was blinded. They didn't know which was which. And lo and behold, this was done maybe 2 years ago. Lo and behold, in the ones stored at minus 80 degrees, the exosomes were intact and great. The ones that were lyophilized, there was nothing in there. It was all dust, and no intact exosomes at all. So, I show people the study in the companies, and they'll say the same thing. Oh, no, our scientists check it, and they show it, whatever. And okay, well, I need more proof than just word of mouth if I'm even going to think about using that. But why would I want to use it if I know that its growth factors work, and if I can isolate that, I don't have to worry about everything else that's in there anyway. Therefore, that gets us to bioengineered. And bioengineered is amazing technology. It's using this Cas9 enzyme. It cuts the DNA strand, and it's being used to take other organisms like E. coli and yeast in a laboratory and they take the DNA and they modify it with a new strand of the DNA, which then programs the cell to make whatever it is you want it to make. Like cytokines and growth factors. We can pick the specific growth factors that we want and train the cell with the DNA change to make mass quantities of just that particular growth factor. So now we can have a wish list and say, well, these are the best growth factors. Make these for us, and we'll have a pure serum with just that and not all the other stuff that we don't need. So it sounds ideal. Well, it is. Years ago when this came out, they used it for making insulin. So instead of using the pig pancreas, now all insulin that's being injected into patients is the genetically modified pure form. And it's rare that you see allergic reactions, so it's super effective. So it's great technology. It won the Nobel Prize in chemistry a number of years ago. So that's what's being used. It came out a while ago, but it took this long to really perfect it, to get to the point where we can have the specific growth factors that we want made for us and put into solutions for us to use. So we finally got to that point, and I've been waiting for that for years to be able to do that. CRISPR technology is what it's called, Nobel Prize 2020. It's used to cure sickle cell disease and other conditions like thalassemia. Blood from patients with sickle cell disease is removed. They get the stem cells. They snip out the DNA. They fix their DNA and they put them back in the patient. And they start making normal blood cells. The stem cells start triggering normal red blood cells, and they're curing sickle cell disease. It's pretty phenomenal that we can do that. It's exciting stuff. Bioengineered growth factors. Large quantities can be made of specifically chosen. We can customize the combination, which is something we never do before. And it makes sense. That's kind of the ideal thing. It makes sense to me. This is our serum. This is a patented formula that we own. There's 10 of these bioengineered growth factors specifically in there. There's no human byproducts. They're all made in the laboratory. You can sell them in Europe and everywhere else around the world because no human products to it, but it's pure. It's exactly in there, exactly what we want, which I think is just ideal. And that's why we switched. So a year ago, we did our own split-based controlled study, double-blinded. It worked better than our serum, which was already working great. But this was better, and the patients loved it better too. And when we wrote the code, because I was the only one that knew it, and I told everybody what they were using, we were all impressed that the treated side of the new stuff was even better than the other side. DNA repair enzymes mentioned as the base of that pyramid. We're bombarded all day long by sun damage, environmental pollution. It causes breaks in the DNA and dimer formation where things fuse together in the DNA. And I heard from an expert that every day we get 10,000 sites of DNA damage in each skin cell per day, which sounds a little bit amazing to me, but he's one of the world authorities, so I believe what he said. And he also said that your skin can only repair 50% of the damage every 24 hours. So you're always losing ground to try to repair your own skin, which is how skin cancers form and aging and all the effects we see from sun damage. So these repair enzymes were formulated back in 2015, and another Nobel Prize was given in chemistry for this. And commercially available are three different types of DNA repair enzymes: proteolase, glycosylase, and endonuclease. Those are available. They get in there and they get right to the nucleus, into the DNA. They cleave the areas where they've been bound together and snip it out, and then allow the cell to repair itself. So it's great technology. It came out in 2015. No one's picked it up that much. You'll hardly ever hear about it. It's expensive. And when I learned about it just recently, I said, finally, we really should put that in our new serums now that we're switching to this better bioengineered serum. Let's add this in as well. It's worth it because it'll make people's skin look younger, reverses sun damage, and it helps prevent skin cancer. And all that's been proven scientifically very nicely. But I thought it was a great addition. So now we have two things in our serums that are both won Nobel Prizes, which I think is pretty cool. Benefits and uses of these serums: anti-aging effect, reduced skin cancer risk, and it removes past DNA damage. So it's not just ongoing, but it can actually fix some of the sins of our youth by getting started. So it's never too late to start using them. And we have this in all of our serums now. So let me talk about PDRA. Because I'm always asked about this as another one of those things that is a fad. So a couple of years ago when I first heard about it, I started looking it up, and I looked and looked and looked, and I spent forever, and I couldn't find anything about it that would make me think it worked for any reason. There were no reports about anything except one case of diabetic foot ulcer that healed more quickly when PRN was put on, which is salmon sperm. And there was some reason, science behind that, about why it would stimulate collagen to help the ulcer heal. And that's it. There's never been a study showing on face and improved wrinkles and anything that would make sense for what we want to use it for. That's tangential. They said, oh, it stimulates collagen, it must work with this and that, and we should use it for facials and microneedling, inject it into the skin. But there's never been a study showing that it actually is beneficial. But the promotional hype is amazing, and the people saying it's the best thing I ever did. You can see that all the time. So I couldn't find anything. So I couldn't think of a reason to ever recommend this or consider it. But I was impressed with how celebrities recommending something takes off. I did find this Chemist Confessions, which is 2 estheticians who do podcasts, and this is number 126. So they've done a lot of this. They do a lot of research, and they said things that made sense to me. So I took a snippet of it's 1 minute of this podcast, which is for 36 minutes, where they're talking about PDRA, that I want you to listen to, that addresses what I've experienced looking into PDRA. And you'll hear in 1 minute, one moment, they also mention exosomes as part of the whole hype thing, because they've done podcasts about that prior. So he's too late.
So I think for me, what I cannot wrap my head around is what is it do?
Yeah.
Right? When we make
Skincare for fun.
yes.
You don't know what it's going to do.
Yeah, so like to me, because we have to spend so much time like testing new products and whatnot, for something to make it to sit in my routine, I have to use it for a reason, like an actual reason. And PDRA really just falls in that like, oh well, why not kind of category. And to me, like I just don't have room for well, why not in my routine. So that's why.
And I think, again, putting this in the exosome space, that kind of like hype science, and another feeling I have is like, this is such a classic example of like hyped marketing ingredients in skincare. Like, comes from a source that didn't actually start in skincare, but has like some science to give it some relevancy, and then it gets dumped, and there's no validation of what it does topically. This is a classic scenario. This is not oh, color me shocked that they did this.
Yeah,
this happens all the time, and it's just a matter of, okay, if we are interested as users, then what are they going to do to show for, like, to actually show it done?
Okay, skincare.
So
Finally, I'm going to show you one anecdotal example that's not so anecdotal. This is a biohacker, Valerie Rossini, and she has her own website, so you can look her up and see her experience in life. And she was on a Procell system for a year before she started. This is using Visio, so we have some, not just anecdotal, this is actual science in action. If you've ever used a Visio machine, it kind of gives you your approximate skin age compared to your stated age. So when she started her treatment, her skin age beforehand was she was 54 years old, and her skin age was 55. So Visio said her skin was a year older than her stated age. 5 Procell treatments over 1 year, and then a year later had another Visio complexion analysis. She's 55 now, and her skin age was 40. So that's not somebody saying, "Oh, hey, look at it." It's actual proof that it actually does something. So I thought that was very impressive. So that's our system. We're great for wrinkles. We're great for acne scars. We're great for hair loss. We have a special formula for that. I have a formula for hyperpigmentation that we're testing right now that I truly believe will be the best in the world. And it's got a bunch of top ingredients that are brand new that no one has out there right now, that are natural. So they're not the chemicals. They're great, they're safe, and I think they're going to work better than everything else. We just want it to be safe to use for microchanneling, so we're testing it now. Great for acne or rosacea, great for stretch marks. Alternate that with fractional laser treatment, and it's very effective for stretch marks. So lots of things. It's really exciting, all the things that you can do. And Adriana has a special to tell you about for coming.
Yes.
So again, thank you to everyone for